Good afternoon to Madam Naima. I'm Shazia. So, my presentation today is about analysis of the family violence screening program at Glenville County Health Department pregnancy clinics. Glenville County Health Departments operate a pregnancy clinic that provides prenatal care services. As part of their services, they conduct a screening for family violence among their patients. However, the current screening method, which is a survey, has shown to be inaccurate. This presentation will analyze the planning and evaluation concept of this program and identify the key issues and suggest recommendation for improvement. I will cover the program's objectives, implementation, evaluation, and quality. Next slide is about problem identification. So, the central problem is the inaccuracy of the family violence screening survey. While the survey indicates a low risk of family violence among patients, healthcare providers frequently encounter women who disclose fear of violence during consultation. This discrepancy means the survey is failing to identify women who need help. This is critical because it prevents the clinic from intervening and providing necessary support to vulnerable patients. To quote the case study, the survey results do not appear to be accurate and it is uncommon for women to disclose living with fear of violence. This clearly demonstrates the problem. For the next slide, I will talk about analysis, which is we have planning concept and evaluation concept. Firstly, let's look at the program planning. The implicit objective is to identify at-risk women to ensure their safety. However, the case study doesn't explicitly state the program objectives, which is a planning weakness. Clear objectives are crucial for a successful program. The target populations is clearly defined: pregnant women attending the clinics. The intervention used is the Family Violence Screening Survey. The problem lies in the tool's inadequacy. In terms of resources, the clinic operates under a limited budget, and a team of 4 staff members led by Dr. Williams is responsible for the evaluation. There are some apparent planning gaps. The case study doesn't mention how the survey was chosen or if it was validated before implementation. This lack of due diligence in the planning stage has contributed to the current problem. Secondly is evaluation concept. The case study indicates that an evaluation is necessary to address the problem of the inaccurate survey. This evaluation should be an outcome evaluation, focusing on the effectiveness of the screening program in accurately identifying women at risk. The case study doesn't specify the evaluation methods. However, suitable methods could include comparing survey results with clinical interviews, using a validated alternative survey, or analyzing patient records. The evaluation team, led by Dr. Williams, is a positive aspect, as Dr. Williams has expertise in public health and evaluation. For the next slide is application. To address the identified problems, I propose the following solution. Firstly, the clinic should replace the current survey with a validated and reliable screening tool. This will ensure that the screening process is accurate and effective. Secondly, the clinic should implement a multifaceted screening approach, combining surveys with clinical interviews. This will provide a more comprehensive assessment of the patients and improve the accuracy of the screening. Thirdly, healthcare providers should receive training on conducting sensitive inquiries about family violence. This will equip them with the necessary skill to identify and support at risk women. Finally, the clinic should develop clear protocol for responding the disclosure of family violence, including referrals to support services. This will ensure that the women receive the help they need. In addition to these solutions, the clinic should also implement a continuous quality improvement process to monitor the effectiveness of the screening program and make ongoing adjustments. Furthermore, a community outreach program can be developed to raise awareness about family violence and promote help seeking behaviors. For the next slide is about the synthesis and evaluation. So in synthesis, the program failures stem from the inaccurate screening tools and potential gaps in the initial planning, such as the lack of survey validation. This issue has significant implication for the safety and well-being of pregnant women. The proposed solution, if implemented effectively, can significantly improve the program outcomes. However, the feasibility and sustainability of these solutions, especially within the limit budget, need carefully consideration. For the next slide is about decision making. The most critical decision is to replace the current survey with validated tools and provide training to healthcare providers. This decision is based on the evidence that the current survey is inaccurate and that provider input is essential for accurate screening. Alternative solutions were considered, but this combination offers the best balance accuracy, sensitivity, and feasibility. For example, relying solely on interviews might be too time consuming given the clinic resources. That's all from me. Thank you for listening.